Hello, my name is David Kraft and I'm a psychotherapist in town in the UK. Today I'm going to talk to you a little bit about cancer phobia, which is very difficult to define because phobias are irrational fears. But of course, a fear of getting cancer is very reasonable. A lot of people die from cancer, so we've got to be very careful about diagnosis. Obviously there are some people that experience some aches and pains, and those people who immediately think, oh my god, I've got cancer, well there's something seriously wrong, seem to be experiencing hypochondriasis. And some people are so frightened they might develop cancer that any sort of ache or pain immediately causes a lot of stress, and they go to the doctor to have it checked out. So these are all the hallmarks of hypochondriasis. Now this is a very well known problem. Some people, however, have a really innate fear of developing cancer, and they fear death. So one could label it, if one has to label these things, as cancer phobia or death phobia, and all these types of phobias have Greek names associated with them, but I tend to use the English word, and they will go to lengths to avoid seeking treatment or getting the tests that they need. Interestingly, these fears, anxieties, will actually have an effect on the autoimmune system. So any suggestions that a doctor might say, which might be negative or give rise to fear, may have an effect on autoimmune system, right down to the cellular level. So it may cause the common cold, but it also may worsen and exacerbate problems and symptoms associated with cancer if you have cancer, or it may give rise to medically unexplained symptoms. So if this becomes severe enough, if you are ill a lot of the time, then it's important to seek treatment in order to reduce these negative ruminations, and the more that you're taken care of, the hope is that you will feel better about yourself in your mind and in your body. What I'm saying here really is that there's a mind-body connection. This is associated with a fast-evolving thought and theory of psychoneuroimmunology, that your thoughts and suggestions, inward thoughts and thoughts from other people and comments, have an effect on your body. If it is affecting your life, your fears or phobias, which may be cancer phobia or death phobia or whatever you want to call it, I would recommend seeking treatment in order to reduce your anxiety and feel better about yourself and your life. If you are a GP who would like to refer a patient to me, please use both the numbers below or email me. For more information, please go to my website, or indeed give me a ring and ask for advice. I do a fair amount of supervision in my work for BISCA, but also with psychotherapists that need help. So I'm happy to do that. If you're a client, please feel free to give me a ring on the numbers below or email me. There's a little introduction to cancer phobia. As I say, it's often inextricably interconnected with death phobia, but also hypochondriasis. You might want to label it one of the above, or you might want not to label it. That's up to you, but there is help available. I have a practice in Harley Street, but also have a practice in Enfield, which is much more reasonably priced. So I look forward to hearing from you. Okay, bye-bye.